bread. The cover man I close, pelting blows. I'm sorry for the drum skin. Me and all is backward. May I not buy me ears. 2, 3 cowbell man, the bell in the hand and a tassa man pumping.
Welcome back, folks. It's 19 and a half minutes after 7 o'clock, and let's talk about what's happening in the health sector. The Eastern Regional Health Authority is celebrating 21 years of its existence. The region boasts of a number of achievements, including the opening of the new Sangre Grande Enhanced Health Center and development of the neonatal intensive care unit. We are joined on set by Mr. Ronald Tsoi. He's the CEO of the Eastern Regional Health Authority, and Dr. Alana Best. She's the Country Medical Officer of Health. Folks, welcome to Morning Edition.
Thank you very much.
Great to have you here. Let me start with Mr. Tsoi. In terms of the Eastern Regional Health Authority, it is rumored that it is the best managed health authority across the health sector. Is that true?
Good morning, Trinidad and Tobago. You start me off flushing away here. Well, you know, over the years, the ERHA has, you know, done pretty well. Since we were established by Act of Parliament in 1994, and some people say, well, how come the 21st anniversary? Because we were in 2018. Mm-hmm. But I always say that the Act of Parliament was the point of conception.
Right.
And thereafter, in 1995, the boards were appointed and so on. And
so it was fully operationalized at that point.
So after that, 96, more 96, 97,
right,
we really took off. Yeah. And so that's why we're doing the celebrations now. Mm-hmm. But we've had a fairly nice history in terms of successes. There was a time when we were the Region of the Year for 4 years in succession, you know, for quality.
Indeed.
Yeah, so we're proud of. So we're celebrating not just the successes, but beyond that, we're celebrating our people.
Fantastic, and I do congratulate you and your team for this level of achievement. But Dr. Best, I wonder, when you look at the people, the processes, the technology being employed by the ERHA, how does that stack up against what we're seeing in the other regional health authorities, the NWRHA and SWRHA and so on? How does that stack up against the other regional authorities, including Tobago?
Thank you once again for having us. I think that the strength of the Eastern Regional Health Authority lies with its people. We do have a very dedicated group of staff that are committed to providing excellent quality of care. I think that excellence is always being strived towards. There's never a sense of complacency. Mm-hmm. As you know, we do cover a very remote and rural part of the population. Mm-hmm. And it's really the dedication of the staff that allows us to continue to provide that coverage. Mm-hmm. From Matlot to Guayari, you have access to quality services at the primary care level, and then we have our central Sangre Grande Hospital as a referral center in. And so you asked how it compares to the other regional health authorities.
Yes. especially in terms of the processes and the technology being adopted by the ERHA.
Right. I think one of our strengths is in fact our size. While we do cover a vast geographic area, the size of our staff is about 2,000, and it's relatively small as compared to the others. So that allows for a tightening of our processes. It allows for greater relationship among our staff, and I think that really is the key to us being able to leverage the capacity within our organization.
Right.
With regards to technology, yes, we do have electronic systems in areas where other regional health authorities may not. So for example, our public health department is fully computerized, which allows us to track our complaints more effectively and so provide a high standard of service to our customers.
To the public. And you know, Mrs. Tsoi, in terms of how you have been able to corral your resources, I mean, everybody is talking about the lack of resources here and the lack of resources there, but in many ways, I'm sure that you and your team have been able to find levels of efficiencies, find levels of effectiveness that redound to the benefit of the public. do you think the ERHA can be a standard model that can, in fact, be utilized in the other RHAs?
Well, I think, you know, the experience of the ERHA has been different. One of the reasons I think, again, that we've been able to be so successful over the years is that we have been in growth and development mode quite a lot. So, for example, when the region first started, the Sangre Grande Hospital, for example, was really like a county hospital. Mm-hmm. Today, it's been grown over the years into a general hospital, so that we've introduced some services, you know, like ophthalmology, oncology services, orthopedics, you know, quite a lot of new services. So that development mode has helped us quite a lot. And I think, yes, to some extent, the models of the development, how we've gone through it, can serve as a useful. But I think the other regions are doing pretty well in terms of their own services and developing. But we had this unique opportunity of growing, and that, I think, also has helped to motivate staff, because they're part of not just maintenance mode, quite a lot, but they're part of a growth experience over the years.
And in that regard, you've recently introduced your neonatal unit, as you mentioned in the introduction.
Yes,
and in terms of, you know, negotiating the funding, the resources, and having the space, the talent to manage such a unit, you're confident that this neonatal unit is a permanent aspect of the ERHA's service delivery?
Definitely so. In fact, we have planned for the introduction of the unit. We've had nurses on training, all right, the specialty training in neonatal intensive care. And also we've collaborated with the other regional health authorities who already have neonatal intensive care units, so that we've been doing a rotation of our staff through their units. So there's a sense that this is not an ERHA thing alone, but it's a collaborative effect on a national basis to impact upon neonatal,
neonatal care.
Yeah.
Dr. Bess, in terms of the services being delivered through the RHA system, for want of a better word, in your estimation, are we as a public benefiting from a higher quality of service delivery given the existence of this RHA structure that supports the Ministry of Health as a public institution?
Right. So certainly at the Eastern Regional Health Authority, there's a sense in which we are responsive to the needs of our population. I think when the RHA system was first conceptualized, the idea was that each RHA would look after the needs of a specific population. And certainly in the East, we have been able to engage our population, to hear their needs, and to then craft services that are relevant to the location. So for instance, at the Eastern Regional Health Authority, we've had a series of public consultations recently, where we've gone to each of the 16 primary healthcare centers to meet with the residents who access services there. And at the hospital as well. And based on the feedback we've gotten, we've been able to now tailor services. So for example, when we went to the Kumana Health Center, the residents who live in the nearby village of Rampanalgas shared the difficulty they have in accessing services because of the poor transportation network. And so come this Monday on the 30th, our team will be going to the community center to have an outreach program to bring the services closer to that population.
To the Rampanalgas villagers.
That's right.
That's fantastic. That is creative thinking. That is common sense, and is not something that you usually attribute to the public sector, but certainly common sense. Look, Mr. Tsoi, the consummate public official professional. But Mr. Tsoi, you know that there's been a lot of disquiet, and people always complain the lack of beds, the time it takes to be processed, triaged in emergency, accident and emergency. It takes such a long time. We've had some horrific stories in terms of baby deaths and so on. People are always up in arms about the quality of care when you're a long stay customer of a particular hospital and so on. Do you think that our healthcare system in many ways has been overwhelmed by lifestyle diseases and that the frequency of visits has increased tremendously, not only with population growth, but also with the higher incidences of lifestyle diseases?
Yes. Let me just backtrack a little bit when you asked about the regional health authorities. And I think the concept was that you separate the provider function from the policy and regulatory function.
Right.
And so the RHAs were more empowered to be able to develop new ways of doing things.
Delivering services.
Delivering services. And that did bring quite a lot of efficiencies. Coming back to your other question with respect to what is happening currently, the CNCDs are a challenge. And I think over the years, there's been a lot of latency and latent disease that is coming forward now. The other thing there is that we find that a lot of the overcrowding at our A&Es and so on is seasonal. So for example, I monitor the statistics around Christmas time. And during Christmas Day, Boxing Day, we had 2 or 3, 4, 5 people in the A&Es.
Right.
And the week after, we shot up to 100 people plus in the A&Es. And so what was causing that is really the effects of the lifestyle over Christmas.
Right.
The poncha creme.
Right, right.
The black cake.
The excesses.
The excesses, the ham. So up goes the blood pressures.
Right.
Up goes the blood sugars.
Right.
And you have that. You also have it festive carnival times and that
Correct.
type of thing, and seasonal. But at the same time, we still understand that there is an increased prevalence that is coming to the fore. And really and truly, the population needs to also, one, take some responsibility for regulating their own health
Yes.
and their own wellness, because I choose not to look at illness alone, but their own wellness. And, as we look at it, they just need to take that responsibility, all right? We have a lot of revolving door, in other words, episodes coming back into our A&Es. They need to use the primary care facilities more. So instead of being illness focused and rushing to the A&E or the hospital, you need to go into your community, use your, and we need to, of course, strengthen our community services to be able to deliver, to educate.
Right.
All right, so that the paradigm shift from illness to a wellness shift.
And being more community-based.
And being more community-based. As Dr. Bess was saying, as a result of our community consultations, we are also starting outreach in the Plummeton area next week, Tuesday, so that we're taking the services out there.
Good.
In an effort to keep the pressures off.
Excellent. Off of the primary institutions.
That's right.
Excellent work. And I hope that it does bear the fruit that you're looking for, and people do experience that improvement in the quality of service. Dr. Bess, people also complain about things like the ambulance service and some of the challenges in getting assistance from an ambulance service in time and that kind of thing. I don't know if you're directly involved in those operational issues, but do you think that there are any common sense solutions that we might adopt?
Well, certainly within the ERHA, we've had the benefit of a new fleet of ambulances to improve the service delivery to our catchment population. Common sense approach.
Yeah.
Well, in addition, okay, so
Maybe we can have different depots for the ambulances. They don't all have to be parked at the same place at the same time.
Right.
That they can be placed strategically
well, that is what
around
we have,
the region.
But this is what we have at the Eastern Regional Health Authority. So imagine if you're in Matlot, which is 3 hours away from Sandy Grande, and you need emergency care. Well, to counteract that, we have an ambulance station in Matlot that serves the population if they need to be accessing services. In addition to Matlot, we have ambulances at Toko and also in the Sandy Grande area. So yes, there are common sense solutions to improving the service delivery. If I may go back to what you were talking about earlier with the CNCDs.
Right.
certainly one of the strengths of our primary care system has been to have that wellness paradigm, to have that more, to have a very strong health promotion aspect to what we do. And within the Eastern Regional Health Authority, we have multiple teams that provide outreach. So, for example, we have our health assessment team that can visit corporations, business spaces to do assessments for their employees. We have formulated a multidisciplinary team that visits the schools, both primary and secondary. So we have our nurses, medical social workers, nutritionists, and health educators there on site, providing a comprehensive approach to screening the children and also allocating people to services where they need assistance. Certainly, I also want to highlight that we also have a camp that targets our young persons who are overweight or obese, and that's set to take place in the first week of August.
Now, I'm sure you're not selling the camp as obese camp, a fat camp.
No.
Right?
No.
So the parents and the guardians, don't have a hard time encouraging the children to attend the camp.
That's right.
Fantastic. But these are all very important initiatives, and it's all pointing in the right direction, a stronger connection with the community and so on. Mrs. Tsoi, Fatt, I'll give you the final minute or so that we have to just reflect on the successes of the ERHA in its 21 years of operation.
Right. But just before going there quickly, I need to point out that the ambulance services that we have within the ERHA, those ambulance services are really for inter-facility transport.
Right.
There's a national network.
Right.
All right, which is the GMRTT network that feeds collecting patients at their homes and bringing them in and so on.
Good.
So it's a double network. The other thing is the Enhanced Health Center that you mentioned earlier. We hope that when we open the doors fully of that Enhanced Health Center, it will impact significantly on our accident and emergency, because it is next door, and we will be able to, the lower level care requirements as our triage system will identify, will be able to go over there.
Yes.
Coming up to the successes, I think we started with the region, and the first thing we did, for example, when we started was to get our health centers and so on up to a level, and we became known for having a brand of facility, keeping the facilities up to a standard, treating with our people with the quality of care that is required, holding, in terms of that quality and that need to treat our people well in terms of a value-driven system.
Well, I want to be the first to say congratulations on the good work that is happening in the ERHA, and of course the people of Trinidad and Tobago, I'm sure they're looking forward to seeing this kind of effectiveness and efficiency, a lot of these common sense and community-based approaches being applied across all of the RAs. And hopefully that will redound, of course, to the significant improvement in healthcare. And I'm sure, sir, that you would have considered that we can export health service in Trinidad and Tobago. We can actually have people come into Trinidad and Tobago.
Health tourism is a reality.
Yes, yes. Fantastic work. Congratulations.
Thank you very much.
Thank you for
Thanks
being
having
here.
us.
Yes. Folks, we still have a lot more in store for you on this fantastic July 27th, 2018.